Okay, so we'll start. Nice. Okay, so good evening, everybody. I hope everyone's well. So on behalf of Dr. KK's HeartKit Foundation of India, I welcome all of you to our 93rd weekly webinar. Our topic for the today's session is the Tooth Fairies visit, dental care for school students, and I'm sure that's a topic that everyone will be very interested to know about. So I would like to extend a very warm welcome to our co-host for today's session, Mrs. Sarika Arora. She is the principal of Ramjas Public School, DB. Engineer Deepshika Dandu, she is the principal of Columbian Foundation Senior Secondary School, Vikaspuri. And Mrs. Somali Das, head of Department Science, Universal Public School, Mahavir Enclave. Well, first of all, welcome everyone and thank you, for joining in today. So I'll hand over to Mrs. Sarika Arora. She will, welcome you all and she'll take you forward on this.
Thank you, Mr. Ankit. First of all, I would like to take this opportunity to welcome all our esteemed guests here and fellow principals. I would like to welcome Mr. Ankit Ahuja, who is a renowned filmmaker, founder and chief operating officer of the Red Comet Films. Mr. Ahuja, you have to your credit dozens of television, commercial and digital ad films. You have worked on reality series such as TLC, Living with Superstars, Shah Rukh Khan, that received special mention across the various categories at Asian Television Awards 2010. And in 2012, you made your directorial debut for the Discovery Channel with the Inside Out, Defense Research and Development Organization, and engaging and widely praised technology series that demonstrates the functioning of India's premier military research and development organization. We also have amongst us our today's expert, Dr. Hanika Agarwal, who's a practicing dentist. She's specializing in conservative dentistry and endodontics. Dr. Hansika is an alumnus of Mothers International School and has represented the school basketball team. She has been active throughout her school life, and she did some track events, and she's passionate about reading history, gardening, and bird watching. So welcome to both the guests and fellow principals, along with the teachers and other students, etc., who are joining. So welcome once again. Thank you. Thank you.
A sunny afternoon to all present here. We are delighted to have Mr. Ankit Ahuja, the moderator, our speaker, Dr. Hanika Agarwal, my co-panelists, Mrs. Sarika Arora, Mrs. Sonali Das, dear students and respected parents. During these lockdown days, we have pampered our family, particularly our kids, with lots and lots of goodies. हम सब ने एक ना एक केक जरूर बनाया होगा. And who is the victim of these yummy delicious treats? Our own teeth. So today we will discuss about teeth issues and how to resolve them from our speaker of the day, Dr. Hanika Agarwal. So eager to hear from you, ma'am.
Good evening, everyone. I hope I'm audible, ma'am.
Yes.
Okay, sir. So as I've been introduced, I'm very, very fortunate and thank you so much for inviting me to the panel to speak to all the teachers and the parents and the children that are here about the Tooth Fairies visit and about our very important topic that we're talking about is how to maintain a good health of our oral hygiene, of our teeth, of the gums, of the tongue. So I would like to share a PowerPoint and go ahead with this presentation and explain a few things to everyone. Is this visible? I hope the PowerPoint is visible to everyone. So as I'm starting off, if everyone can see, it says the mouth is a gateway to our body. So very simple saying, a healthy mouth will lead to a healthy body. Whatever we put in our mouth will go into our body, and that's what we are trying to make of our body. We're going to make a healthy body if we have a healthy mouth. So if we have a good oral hygiene, whatever we are eating, along with maintaining our oral hygiene, that is keeping our teeth clean, keeping our mouth clean, will help to have a healthy body. The various organs in our body, there are various parts of our body, each of which can get easily affected if they are not keeping a good oral hygiene. If we're talking about kids, the kids are all in a growing age. They're having a growing body, their minds are growing, their muscles, their bones, everything is growing right now. So for them, it's very, very essential to have a healthy diet and also to keep their mouth clean and free of extra bacteria and germs. So this is the diagram of a tooth. So let's talk about what does the oral mouth of oral cavity comprise of. क्या-क्या चीजें हैं हमारी mouth में जो हमारे को जिनका ध्यान रखना है. So the first thing is the tooth. In a kid, if a child is below 6 years of age, आपके mouth में there are 20 teeth, and once you start growing and your permanent teeth start coming, so slowly and steadily, when you are an adult, you will have around 32 teeth in your mouth. These teeth are made of a hard structure. जो बाहर white area that you can see is either an enamel layer, and inside there's a whiter yellowish area that you see, which is the dentine. उसके अंदर there are nerves and vessels that are coming inside the tooth. So whenever we get dental decay या हमें कोई problem होती है in the tooth, there would be pain because the tooth is not a dead object. The tooth has nerves and vessels. So I like to tell children that the tooth has feelings. कि उसके अंदर भी pain होगा when you will have some kind of problems like dental cavities. Other things that are important that you have to take care of apart from the teeth are the bone and the gums that the teeth are lodged into, your cheeks and even your tongue. So these are the three essential elements which comprise the mouth. Now, what are the functions of your teeth? The teeth help you to cut the food. जब आप कुछ bite करते, you're taking a bite into an apple, you're cutting and you're tearing. If people are eating non-vegetarian, you're tearing into the food. Then you're chewing into your food. You're chewing them into small pieces. You must have heard your elders tell you कि अच्छे से चबाओ, and the stomach doesn't have any teeth. So the better you chew your food. Actually, there has been recent study that kids these days are not chewing their food enough as compared to the times earlier, because either we are in a hurry or we have some kind of, computer games or something going on, some TV going on in front of us. So we're in a hurry to chew our food. And that leads to a lot of digestive problems because the stomach is not able to then digest that unchewed food properly. So if you have a good set of teeth, you'll be able to chew your food well, and then the digestion will be better and you will have a better lifestyle. So like I said, stomach has no teeth. So the mouth also has a little bit of saliva, which has an enzyme which will break down the food. So the better you chew your food, the digestion begins in the mouth itself. Needless to say, a good dentition helps you to have a good smile. So if you have, you don't have any cavities and your smile looks nice, you have more confidence and you speak better. Your a lot of our sounds come out well if our teeth are intact and our tongue lands properly against the floor of the tooth or the palate. So these are the main functions of the teeth. Now, along with that, a lot of parents think, and a lot of patients who come to me think that why are milk teeth important? ये तो टूट ही जाने हैं. These are going to fall off, and it's okay if they get dental cavities, but please be aware that they're as important as your permanent teeth. Along with chewing, cutting food, breaking the food down, helping you to speak, they have two very important functions. One, they are maintaining the space for the permanent tooth. There is a timeline. एक time पे एक milk tooth गिरता है, जो दूध का दांत है, let's say it's falling off at 6 years of age or 7 years of age, 11 years of age, 11-12 साल तक दूध के दांत गिरते हैं. And if we get a dental cavity or if we get any kind of decay before that time and the child has pain, उसको decay हो गया है, वो उधर से खाना नहीं खा पा रहा है, the infection definitely can travel to the permanent tooth below, तो उसको harm होगा. अगर ये tooth टूट गया, गिर गया, then there is no space that tooth was holding. तो जो permanent दांत आएगा वो उस जगह पे आएगा नहीं, क्योंकि आगे पीछे के दांत टेढ़े मेढ़े हो जाएंगे. So the permanent tooth might not come in the correct position and the child might need braces or some other interventions later on. So to maintain that tooth till the time it is the right time for it to fall off is very, very important. The last thing is that milk teeth maintain bone. अगर आपके milk teeth नहीं होंगे तो आपकी bone का structure भी अच्छा नहीं रहेगा and your permanent teeth are again not going to come out in the right position. So we have discussed about what is the importance of your teeth, including your milk teeth and your permanent teeth. Now you know that teeth are very important. They're vital structures to help you chew your food and digest that food. I would like to bring an important emphasis here. Inside your mouth, there are a lot of bacteria. There are more bacteria in your mouth right now than there are people in the world. But it's not a scary thing. Most of these bacteria are very, very friendly and harmless bacteria, unless and until we are not giving them certain ingredients to cause problems in our teeth. So what we have to do is maintain a healthy lifestyle. We don't have to give them junk food. We don't have to give them excess sugar, because when they get excess sugar, they react with that excess sugar. So what happens if there are already bacteria and germs present in your mouth? As much as you brush, whatever you do, there are always bacteria and germs present in your mouth. But when they combine with excessive sugary foods, like a lot of junk food, a lot of cola drinks, and a lot of things that have excessive starchy, sugary things, they together will act and produce certain acidic products. These acidic products are going to act on your healthy tooth and cause dental cavity. They are going to erode your enamel and dentine, that hard structure I showed you. And then they are going to act and cause damage near the pulp tissue, that is the tissue, and then cause pain and cavities. So we have to avoid all these kind of things and maintain a healthy lifestyle. So if we do not take care, we can get dental cavities like you see in these pictures. We can get gum diseases. There'll be deposits on the teeth. If you're not brushing well, those deposits will look like something yellowish structure on your tooth, which is called a plaque. Slowly and steadily, if the plaque is not removed, it gets harder and harder with mineral deposits and it becomes something called as calculus. Now this plaque and calculus is very harmful for your gums. And the gums start getting thinner and shifting from the tooth. And the tooth may slowly start moving also. So very important to brush well and prevent cavities. So what will happen, let's say if we don't take care of our teeth, like I told you, there'll be cavities. Now these cavities are also going to cause pain because the tooth has nerves in it. It's going to cause sensitivity initially, maybe to hot, cold things. It definitely will look bad if it's there in your front teeth. Once there are cavities and once there are deposits, these are irritants to your gums. So the gums will start bleeding. They will not be pink anymore. They will start looking more red. And you will have pain while brushing. You will also have some bleeding while brushing. You may have infections in the tooth. There may be pus, which once the nerve inside the tooth gets involved. The pus is nothing but bacterial growth oozing out. Which is also may happen around the gums. And all these bacteria, excessive amount of bacteria producing a lot of sugar and acid will cause bad breath also. Definitely all these things, once they go inside our mouth, we gulp it down. We're gulping all that things down. We'll go in the vessels and will go circulate from our heart towards all our organs, will cause a lot of detrimental issues throughout the body. These plaques, these calculus plaques can go lodge inside arteries, inside vessels. Pregnant women are it's very, very harmful for them to not have a good oral hygiene because it can hamper the growth of the baby also. So it's very important for your body to have a healthy mouth. So now I think I've scared everyone enough. Just told you that what all wrong things can happen. But and like ma'am said, that we have baked a lot of cakes and we have had a lot of goodies. But it's very easy to just maintain a very basic good oral hygiene. I have just listed 5 points here, The first thing is that we have to brush well. I know it's a very simple thing I'm telling you, but brushing well is very, very important. Twice a day we have to do it. Please remember, kids, it's 2 times a day. Once in the morning, once you've woken up, either just after your milk or snack, just brush before you're going to sitting on your online sessions or going to school. And once, very, very important, is at night. Before you sleep, brush well and do not eat anything after that. You can have water, but don't eat anything after that, because the bacteria in your mouth increase their activity at night time when you're sleeping. And all that food that you had eaten the whole day has not been removed if you haven't brushed. So those bacteria will act more on these food particles which are remaining in your mouth. So remove all that food particles, brush, and then sleep at night. So brushing 2 times a day is essential. You can buy a regular medium brush. You don't need any fancy electronic brushes or anything, just a medium brush and a non-abrasive regular toothpaste. The toothpaste should not be very grainy, it should not be very abrasive. Don't use a tooth powder. Any regular toothpaste, and toothpaste quantity now has to be very, very small. एक मटर के दाने जितना आपको toothpaste अपने brush में लगाना है. Don't, like you see in the ads, that long strip of toothpaste is not needed. Very small amount of toothpaste. It's more the action of how you hold the brush, which angles you're holding the brush. You're brushing on all the surfaces, bahar ki taraf, andar ki taraf, and then you're brushing everywhere in your mouth is very important. The second point I had told you was to floss. Now, in our, a lot of people don't floss very often, but if you get into this habit, it is very, very good for our teeth. In my practice in our clinic, we see a lot of cavities that happen in between the teeth. मतलब 2 दांतों के बीच में, एक ये दांत है, एक ये दांत है, cavity यहाँ दांतों के बीच में हो जाती है. Because वहाँ पे थोड़ा बहुत खाना that gets lodged and that's not coming out with the brush. So you can just take a floss and you have to pass it between your teeth. There are different kind of flosses that are available, and a hook also that have a thread in between. You can pass that between your teeth. Whatever is easy. Start with doing it once a day before sleeping. And if you can't do it every day, start with alternate day and then increase the habit of flossing. It's a simple thing, and your teeth will serve you a very long time, and the gums would be healthier if we get into this habit. The third thing I mentioned was about mouthwash. Now, I don't mean that you buy a commercial mouthwash. Don't need to invest in any of that. I just mean regular rinsing your mouth with water, squishing nicely, because food gets in between the cheek pads and the bone of your teeth, right in the sulcus. That area is called the sulcus. So khana aapka andar jaake phas jata hai. So after your breakfast, after your lunch, and after your dinner, just rinse nicely. अच्छे से कुल्ला करना चाहिए आपको, and आपको अच्छे से squish करना चाहिए once you have had your meals, so that nothing is there in your mouth. It will also prevent bad breath and it will keep your mouth healthy. So general rinsing thrice a day after your meals is the third point. And then the fourth point is tongue cleaning. Now, you can do it while you're brushing with your brush, but if you can invest, आप एक अच्छा tongue cleaner ले सकते हैं, which is a metallic one, a stainless steel tongue cleaner, and just clean your tongue 5 times. The difference between using a brush and a tongue cleaner is a lot. Tongue cleaner cleans your tongue much better, and tongue की जो coating होती है, जो bacteria होते हैं, वो सारे हट जाएंगे. Your mouth will feel much fresher. You will notice on your own. And the fifth point, I cannot emphasize more, that no junk food, especially no cola drinks, no aerated drinks. They're very, very bad for your teeth. If you're having anything that stains the teeth, जैसे आप अगर there are adults who are in the session who are taking tea, coffee, and if you're having a lot of staining products, so आप अपने mouth को rinse कर लें. Rinse your mouth so that there is no stains on your teeth. And try to avoid junk food. आप उसका एक time बना लें that my toffee, my chocolate will happen at this time of the day, and then I will brush my teeth and I will not have it at other times. Now, I'd like to just lastly emphasize on certain bad habits that we might develop while we're growing and which might be detrimental for our oral health. A lot of kids and even adults have this habit of nail biting. Now, nail biting, what harm it can cause to our teeth and our body is that, one, nails are very hard structure. If you have a long-term habit of nail biting, आपके ऊपर के दांत, नीचे के दांत वो घिस जाएंगे, and they can crack also very easily. So you will have harm to your own teeth. Apart from that, you're touching all the surfaces, you're out and about. In this day and age of coronavirus, we know that hand hygiene is very, very important. But if you're touching something and if we have a habit of nail biting, then we're taking all those bacteria and germs in our mouth and in our body again. So I can't emphasize more that, nail biting is not a very good habit, and we have to try and avoid it. Nowadays, there are lots of things you can, there are lots of, distraction objects that have come. You can use spinners, those poppets have come. So just keep your hands busy, do some activities, do some knitting or anything like, those weaving things have come. There are lots of activities that can be indulged into and we can avoid, nail biting. This kind of habit, which is called thumb sucking, happens in very young kids. Until the age of 4, as a dentist, we say that it's a normal activity. If a child is having a habit of thumb sucking till the age of 4, it's normal. If you do see a child which is still having a habit of thumb sucking, it will really change the shape of their bone, and the bone will become forward because the thumb is putting pressure and the child is growing. So unki bone ka structure hi change ho jata hai, and their teeth start coming out in a very different manner. They will need braces and they will need lip corrections. Unka mouth hi khula reh jata hai. They might have an open mouth. So it's not a very common habit, but if someone does have this habit, you have to take them to the dentist, and there are habit correcting appliances. Your dentist can make appliances that will prevent the child from doing thumb sucking. So this can be something that has to be taken care of. The last thing is that is very common nowadays is for kids to have a habit of mouth breathing. Parents don't come to know sometimes, but if you notice that your child is mostly breathing through his or her mouth, it could be because they have blocked sinuses. Aajkal, maybe when there is a lot of pollution and we have a lot of issues like pollen and dust allergies, kahin bachon ke noses blocked rehti hain completely, and they become into a habit. They develop a habit of breathing through their mouth, and if they're breathing through their mouth, they will start having issues like a dry mouth, muh mein saliva aur thuk kam banega. Bad breath, then more cavities in the teeth because the saliva has a coating on the teeth. Agar aapke muh mein saliva kam hai, to cavities zyada hongi. So controlling this habit is very important. Telling your child that, keep your mouth closed, breathe through your nose, and obviously showing to an ENT and getting their nasal corrections done. Jis bhi reason se unki naak band hai, because we all know that when we breathe through our nose, that's the natural mechanism. In the nasal passage, there are hairs and things that will capture all the dust particles and bacteria that are going through your nose. But there's no such mechanism in the mouth. So if you're breathing through the mouth, you're taking all that air without filtration. Your nose is a natural filter for your air. So make sure that that kind of a habit, is stopped and controlled quite early. So I think this was what I was trying to tell you, and thank you so much from our team of Green Park Dental, and thanks for inviting me. And I am very open to all the questions that anyone wants to ask. Thank you.
Thank you, Dr. Anika. Thank you. That was a very insightful session, and I'm sure all the kids got to learn a lot of things. So before we move on to the questions from the children, and I would just invite Ms. Somali Das to also say a few words, and if she can also give us some point of view on the topic.
Absolutely, sir. Yes.
Thank you so much, sir. Wonderfully explained, ma'am. You wonderfully explained all the aspects of the dental hygiene and oral hygiene that are that the students or the children must take care of. And I think you have covered all aspects, from the how to take care and what are the implications of not taking care of dental health. That has all been explained so well. So there are a few things that I, on a personal point of view, I wanted to ask you from our side, that what are the signs that indicate that teeth are being affected? How do the children or the parents know that the teeth are being affected of the child?
Yes,
how do they come to know about that?
Yes, ma'am. So I tell all my patients, who the parents, especially, to start getting your child for a dental visit before they develop any problem. So when the child is 2 years of age, that's the time they have all the milk teeth in their mouth, 2.5 years of age. So by 3, एक तो उनका dental visit start हो जाना चाहिए. That is a general checkup. जब वो आएंगे, they will look around in the clinic. They'll have a look at the chair. They will play around. So most of the kids who come with a dental problem by the age of 6, 7 are very, very fearful of a dental clinic. And ये एक ऐसी चीज है, आपके मुंह में 32 दांत हैं, डेंटिस्ट के पास तो लाइफ में जाना ही जाना है. So अगर जितना अर्ली एक विजिट स्टार्ट हो जाए, एक तो बच्चे का डर निकल जाता है, and a professional can look at your child's mouth and let you know कि कोई ऐसा major issue तो नहीं है. Mostly in these children there is nothing there as an initial stage. तो एक चेकअप हो जाता है. From the parents' point of view, at that time we can counsel them कि 2-3 चीजें जो आपको make sure करनी है, जो आप नहीं करें. Few things starting from very small children. अगर जो parents अपने बच्चों को दूध की बोतल के साथ सोने की आदत डाल देते हैं कि if you're sleeping, दूध मुंह में लगे लगे सो जाते हैं और उसके बाद ब्रश नहीं किया, again उनके सारे मिल्क टीथ में कैविटी हो जाती है. It's called nursing bottle caries. तो एक वो प्रिवेंट करना है. आपको अपने बच्चे के दांत को साफ रखना है. आई वुड रिकमेंड टिल द एज ऑफ 4 और 5 कि पेरेंट्स खुद ब्रश करें अपने बच्चे के दांत. और जब वो खुद ब्रश करेंगे तो वो अपने बच्चे के दांतों को नोटिस करेंगे. जो दांत पहला व्हाइट लग रहा था, वो किसी दिन में उसमें कुछ ब्राउन स्पॉट दिख रहा है, दैट मीन्स कोई कैविटी हो गई है, या कोई डिपॉजिट दिख रहा है, कुछ भी डिफरेंट इन कलर दिख रहा है, you should call a dentist because you can't, your eyes are not trained to see that kind of cavity कि वो blackish spot क्या है, वो ब्राउन स्पॉट क्या है, बट यू विल नोटिस इट कि वो व्हाइट की जगह कुछ ब्राउन हो गया है. व्हाइट टू स्ट्रक्चर चौकी भी चौक के जैसा हो जाता है, सो देयर इज सम कैविटी हैपनिंग. तो ये सब चीजें आप नोटिस करेंगे अपने चाइल्ड में, देन यू विल ब्रिंग देम टू द डेंटिस्ट. With elder kids, I would say once they're older, they will notice themselves. Agar if they're not taking care of their mouth, the first symptom we get once the cavity becomes very deep is sensitivity. आपको ठंडा लगना शुरू हो जाएगा. With regular water also, आपको नॉर्मल पानी से भी ठंडा लगना शुरू हो जाएगा, स्पेशली जब प्लाक एंड डिपॉजिट बहुत ज्यादा हो जाता है, तो दांत बहुत सेंसिटिव हो जाते हैं. इफ वी नेग्लेक्टेड इवन फर्दर, तो ठंडे के बाद गर्म चीजें भी लगनी शुरू हो जाती हैं, तो चाय भी फील होने लगेगी. एक बार चाय और गर्म चीजें फील होने लग गई, इट्स एन इंडिकेशन दैट आपकी कैविटी इतनी डीप है दैट यू माइट नीड समथिंग कॉल्ड अ रूट कैनाल. So regular checkups का emphasis बहुत important है, and obviously you will come to know by these symptoms कि आपको कोई sensitivity हुई या कोई pain हुआ, then that means your tooth is involved. बाकी I showed certain pictures कि दांत का color and gums का health का color, it's a pinkish color. अगर आपको symptom आ रहा है of bleeding while brushing, that means gum health में कोई issue है, you should go for cleaning of your teeth. And you may be not holding your brush very well. कोई deposits हो गए हैं, that will cause bleeding. So ये सब चीजें आप नोट करेंगे कि नेचुरल टीथ के ऊपर कोई रफनेस आनी शुरू हो गई, यू आर जनरली फीलिंग कि दांत बहुत जल्दी रफ हो जाते हैं, एंड अगर आप यू रन योर टंग इनसाइड योर टीथ, वो स्मूथनेस नहीं रही है, सो दैट मीन्स कुछ डिपॉजिट्स आ गए हैं. So these are certain things you can note, and definitely regular dental checkups annually for everyone, adults and children, is must.
Yes, ma'am. Some children are asking some few questions. One of them are asking that my teeth are not all equal. Then what do you suggest for that?
So, ma'am, depending on the age of the child, if I don't know the age of the child who's asked this question, but अगर 11 साल से कम एज का बच्चा है और दांत अभी उनको टेढ़े मेढ़े लग रहे हैं, they're feeling that they're not equal, so still new teeth are coming. तो अभी alignment change होएगी. बट स्टिल एट द एज ऑफ 9 और 10 आई वुड प्रेफर कि आप एक ऑर्थोडोंटिस्ट जो दांत की अलाइनमेंट को देखते हैं, दे आर कॉल्ड ऑर्थोडोंटिस्ट्स, उनको आप अपने दांत दिखाएं. दे मे से कि आपको ब्रेसेस की जरूरत है, एंड ब्रेसेस लगते हैं जब आपके परमानेंट दांत सारे आ जाते हैं. सो विद गर्ल्स दैट्स द एज ऑफ अराउंड 11 और 12, एंड विद बॉयज इट कुड बी अराउंड 12 to 13. दैट्स द आइडियल एज ऑफ पुटिंग ब्रेसेस. अगर दांत टेढ़े मेढ़े हैं, उसका सोल्यूशन होता है कि ब्रेसेस लगाए जाए. ब्रेसेस पहले वो ब्रैकेट्स और तार लगती थी. आजकल there are a lot of latest things like Invisalign, which are invisible braces. So they have also come into the market. So there are a lot of options to straighten the teeth. तो जब दांत टेढ़े मेढ़े हैं, उनको स्ट्रेट किया जा सकता है. बट अभी अगर आप छोटे हैं और अभी आपको टेढ़े मेढ़े लग रहे हैं, you have to wait. जब सारे परमानेंट दांत आ जाते हैं, तब उनको सीधा किया जाता है.
The child is writing he is 11 years old.
So now this is the ideal time to go to the orthodontist.
Okay.
Because then he'll miss the window. He should definitely go and get a checkup if he feels कि दांत टेढ़े मेढ़े हैं.
Then once the permanent teeth are all there, then they can go to an orthodontist. Now,
Yes.
is there a difference between a dentist and an orthodontist? Some special, someone.
Yes. So as in medicine, जैसे आप कहें there between a doctor and a neurosurgeon, तो doctor तो दोनों ही हैं. Dentist, तो सारे dentists are dentists, but there are specialization in dentistry also. And if you want me to mention them, there are various fields. बच्चों के dentist को pedodontist कहते हैं. जैसे my field is endodontics, so I specialize in root canals and cosmetic dentistry like building your smile. Then braces के लिए अलग होते हैं, उनको orthodontist कहते हैं. आपको कोई ट्रॉमा हुआ है, आपका विजडम टूथ निकालना है, कोई सर्जरी करनी है, तो उनके लिए ओरल सर्जन होते हैं. There are different types of dentists. Yes, ma'am.
Okay. Do you suggest a special type of toothpaste for the children?
नहीं मैम, like I told you, for bigger kids जो class 5 के above है, 4 के above है, जो अपना brush अपने आप कर रहे हैं and जो toothpaste को थूक सकते हैं, very young kids tend to swallow the paste. तो उनके लिए कोई भी regular paste which is non-abrasive. Non-abrasive means I don't want you to use Dabur, Dant Manjan or Vico wala and those abrasive ones. Any regular toothpaste is okay and बहुत थोड़ा सा लगाना है. जो छोटे बच्चे हैं, जो बहुत छोटे हैं, they can't really spit out, तो उनके लिए कोई भी नॉन फ्लोराइड बेस बच्चों का टूथपेस्ट आता है, किसी भी कंपनी का, पिजन का आता है, शिको का आता है, वो सब ले सकते हैं. जिनके पेरेंट्स को लग रहा है कि उनके बच्चों को बहुत ज्यादा कैविटीज होती हैं, they should definitely show to the dentist, but anti cavity टूथपेस्ट भी आते हैं, but they are expensive, so I would suggest कि आप डेंटिस्ट को दिखा के ही उनको प्रिस्क्राइब करवाएं.
Okay, ma'am. Okay. Any other questions?
Yeah, so I think a lot of people, some people, I think when you're giving the presentation, they also want to understand again about the different parts of the teeth. If you can just tell us about that.
Yeah, I will just share that again. So see, जब आप बाहर से when you're looking at your tooth, I'm sorry. When you're looking at your tooth, it looks like a white structure, right? So that's just the outside of the tooth. And that outside of the tooth is made up of a white structure called as the enamel. वो हमारे दांत का सबसे, हमारी body का सबसे hardest structure होता है, which is called the enamel. So this structure that you see when you're smiling is called the enamel. Enamel के नीचे एक layer होती है called the dentine. And this is this yellow structure that you see. This is the dentine. ये डेंटिन होता है, which is softer than enamel. So अगर आपको कोई कैविटी हुई जिसने enamel को भी break down कर दिया है and it's gone into the dentine, it will travel very fast towards your tissue area, which is the pulp. उसको हम अपने language में pulp बोलते हैं, in the dental language. Pulp because it looks like the pulpy, जैसे आम का pulp होता है. So it's very pulpy in nature, which is, and if you see that tissue, it's a red tissue. Red tissue because it has vessels, blood coming in and nerve होती है. So nerve is something that is causing the signal. तभी जब आप कुछ एकदम से अगर आपके दांत के बीच में कभी कोई पत्थर आ गया, या if you have something very hard, suddenly there is a current that you feel, or if you have a very cold ice cream. So in the enamel there are grooves, so it can travel, that sensation travels to the dentine and that tells your body कि नहीं, कुछ गलत खा लिया है. It's too cold or it's too hard and you don't have to eat it. So it's a protective mechanism for your teeth to have these nerves and vessels in it. To have that mechanism कि आप कुछ गलत ना खाएं, नहीं तो अगर हमारी बॉडी में कहीं पे भी नर्व या वेसल नहीं होगी, we will not be able to know we're burning our hand. So similarly for our tooth, we'll not come to know that we're doing something wrong with our teeth.
Okay, I'm sure that children must have gotten it now. So Dr. Hanika, I think there is a couple of few things, like people are saying what is the best style of brushing your teeth? Like you had mentioned that it just has to be like a pea-size
Toothpaste.
Toothpaste, but is there any method?
Yes, definitely. There is a style of brushing the teeth, and the workshops I take with kids for the last 1 year online, when there's a smaller group, I definitely ask them to get their brush and we see it online. But it's very difficult to teach everyone on such a big group how to brush, but there is an angle to hold the brush, which is at a 45-degree angle. Maybe we can, Google certain videos or visit a dentist, which is the best. Always brush with your mouth open. That's what I'll say. When you keep your mouth open, you have to keep your brush on all the surfaces of your teeth. So the outside and the inside, brush on the out and the in of all the teeth. So this side, this side, this side. Divide your teeth into 6 segments: back, front, back, back, front, back. So there are 6 segments. Each segment has to be brushed from the outside and the inside. So this is the basic technique. There's an angle also how you hold the brush at a 45-degree angle so that you don't horizontally brush, because I have seen a lot of patients which are at the age of around 40, 45 who are brushing very vigorously, for the last 20 years.
Yeah.
And they have developed some grooves in their teeth because excessive horizontal brushing ho jati hai. So there's an angle to hold the brush that's at a 45-degree angle. So this we teach in our practice to every patient who's coming and getting their cleaning done. It's definitely a little task to do it online, but I hope I'm able to clear certain doubts.
I'm sure. And how much longer do you think a person should brush? That's also, I think,
Right.
something
So
we need
if
to-
you are starting with this kind of a technique that I've told you, that open your mouth and brush the 6 segments outside and inside. Initially, to train yourself to do that will take around 2 minutes. So more than 2 minutes, it should not be brushed. Some people are in a habit to keep rubbing. No, just 5 strokes on the outside, 5 strokes on the inside. So same 5 strokes on all the segments is more than enough. After that, your tongue cleaning and maybe flossing. The entire process, once you're used to it, won't take more than 2 minutes.
Okay. And we've got another question from someone who says that, their daughter is 6 years and 2 months, but they still haven't, the milk teeth haven't fallen yet. So is there any reason for a delay, or is it a normal thing?
This is not a delay. 6 years and 2 months is the starting period, ma'am. They will initially start with the lower 2 teeth here. These 2 teeth will start moving, and that can start at 6. So 6 year 2 months is just the starting phase. And nowadays it's a delay only with children with the kind of diet that we are having. We don't eat a very hard diet anymore. So the teeth don't fall off very easily. A lot of parents bring their kids where the teeth are coming behind and the milk teeth are still there in the mouth. So
Okay.
once they've not started moving, but right now it's too early. So they can still wait for another 6 months, 1 year. And then if still the teeth are not falling off, then they can show to a dentist. The other thing I would like to point out for a 6-year-old, that the first molar will start coming at the back. A lot of parents don't know this, that apart from the milk teeth falling, a permanent molar on its own, without any milk teeth falling, starts coming at the back. So please remember to brush those permanent molars, because a lot of parents don't know that a molar also comes at the age of 6.
Okay. So now I'll also like to invite, Mrs. Sarika and Mrs. Deepshika to, if they have any questions.
Yeah, this information has been really useful for the children, I suppose, and for all of us also. Actually, I have seen many people are having some problems like bad breath or something. So how to control that?
Yes, ma'am. Thank you, ma'am, for inviting me. Really wanted to thank you for all the work that you guys are doing here. Bad breath is a very, very genuine problem, and it has 2-3 reasons associated with it. One would be your oral hygiene. कि आप brush अच्छे से नहीं कर रहे हैं, and आपके मुंह में deposits हैं, that plaque and calculus picture that I showed you, and that will cause bad breath because that is excessive amount of bacterial growth in your mouth. The second cause is digestive issues. अगर आपको acidity का problem है and you have acid reflux, that will also cause some amount of bad breath. And again, if you're not cleaning our tongue, तो ये 2-3 चीजें हैं. अगर हम अपने mouth को अच्छे से healthy रखेंगे, we will clean our tongue and we'll rinse our mouth after every meal, तो bad breath becomes very less. उसके अलावा भी bad breath है, so you have to visit a dentist and एक deep cleaning करवानी होती है. And obviously gastric evaluation zaruri hai if patients have a lot of bad breath.
Thank you.
Ma'am, wanted to know more about flossing. Should we do it or not? Western countries go in for a lot of floss work. So please highlight about that also.
No, ma'am, I would, like I said, I see a lot of patients with cavities in between teeth. तो फ्लॉसिंग बहुत जरूरी पार्ट है डेंटिस्ट्री का, जो हम लोग इंडिया में इतना नहीं करते और वेस्टर्न कंट्री में बहुत ही ज्यादा करते हैं. मे बी दे वेयर ऑफ देयर टीथ विद टू मच फ्लॉसिंग. दैट्स व्हाई आई डोंट रेकमेंड आप दोनों बार करें, सिर्फ रात को करें. नीड नॉट बी ट्वाइस अ डे. once a day also is enough. Even if not once a day, you can do it every alternate day. But in between teeth, जो आप खुद ही देखेंगे after brushing, so just do it today. After brushing, पूरा brush करने के बाद just take a floss and pass it between your teeth. And आप निकालेंगे बाहर, there will be a little bit of plaque. वो जरा सा deposit बाहर आएगा. So that is there. वो brush से नहीं निकला है, वो दांतों के बीच में है, वो floss से ही बाहर आता है. And it would be a little smelly, and you will know कि ये 2-3 दिन पुराना है. It's not something that happened today. It's been there for a while. So regular flossing is very, very important. And definitely बहुत cavities prevent हो जाएंगे उससे. मैम आप म्यूट पे हैं.
Mute पे हो मैम.
Hello, ma'am. One question is there. One child is asking that he is 13 years old, and his growth problem is there in his teeth. Their teeth are not coming out in the proper, taking a longer time. So any
If this is a boy and the teeth
he's
have
a
not,
boy.
the teeth have not come out at 13, which teeth haven't come out? I mean, there must be these premolars that still have to come out.
Okay, okay.
अगर ये premolars अभी भी नहीं निकले हैं and still some
Canines. He is saying canines.
Yes, canines also sometimes have not come out. तो एक dentist के पास जाके एक X-ray कराना होता है, which is called an OPG, which is a full mouth X-ray. उसमें हमें canine की position पता चल जाती है कि सीधे आ रहे हैं कि नहीं. Sometimes canines are coming, you know, in a wrong direction. वो एक X-ray से ही पता चलेगा कि अभी तक बाहर क्यों नहीं निकले. Today only I had a patient who was 11-year-old and we took an OPG and the canine was coming like this.
He is saying that he has done the X-ray and no permanent teeth has come out till now.
No permanent teeth has come out in the mouth, but X-ray में तो bone के अंदर तो दिख रहे होंगे ना.
Okay.
So the OPG X-ray covers the entire bone till here. So if the teeth are here in the jaw, they will be visible कि वो कहाँ है to the dentist.
Okay.
So he has to take an OPG, not a small छोटा X-ray नहीं लेना है. एक बड़ा X-ray होता है, उसका नाम होता है OPG, ऑर्थोपैंटोमोग्राम. OPG ही कराना है and OPG में ही दिखेंगे कि दांत कहाँ पर है. What's the location of the permanent teeth?
Okay. Okay. And one thing more, what is a good diet for a healthy teeth? What children must take care of their diet? How will they take care of it? What diet suggestions do you give for healthy teeth?
Ma'am, diet is a completely like whole topic on its own, but definitely I would suggest कि जो main 2-3 चीजें मैंने बोली हैं वो तो बिल्कुल ही नहीं लेनी है. Lot of kids already are in a habit तो control करना मुश्किल है कि आप cold drink ना पिए and you know too much of junk food ना खाएं, तो उसको आपको limit करना है. Try to control it. Maybe you're going out with your family on a dinner night, तब ले लिया. But you know घर पे every day Maggie, cold drinks every day is not a good habit. Definitely. तो healthy diet घर का बना हुआ कुछ भी खाना आप खाएं, जितना भी घी डालें उसमें, that is fine. चीनी की जगह शक्कर खाएं, like you know in winters you can have a lot of gur and shakkar. Too much of cakes, pastries, pizzas, pastas, burgers, even these मैदे वाली चीजें are sticky and they will go into the grooves of your teeth and वो stick हो जाते हैं वहाँ पे, पता भी नहीं चलता है. Like you know eclairs, sticky candies like 5-star and all these starchy food, मैदे वाली जितनी चीजें होती हैं. Even अगर आपने कभी भी untoasted bread कुछ चबाई हो तो you will know how chewy it is. It is थोड़ी सी you know it is chewy, so it will stick on your teeth. So I would suggest सुबह उठ के बच्चों के लिए तो अच्छा है सुबह पराठे खाएं अपना and healthy home cooked meals. Lunch can be, I mean you know diet तो बहुत ज़्यादा you know they can have for eyes, they can because nowadays we are always on the screen. So they should have a lot of green leafy vegetables, अपना you know vitamin A for the eyes, lots of carrots and cucumbers. बहुत से बच्चे हैं जो vegetables बिल्कुल नहीं खाते, you know like my kids also, it's very difficult to you know get them to eat vegetables. So in whatever way they can, you know if they're wanting to have you know a pizza, then they should try to get you know घर पे dough बना लीजिए या you know get a whole wheat dough. Thin crust ले लें, जो thin crust is not very chewy. So you have to choose wisely in your kind of meal choices also. अगर आप बर्गर ले रहे हैं तो यू नो टॉप ब्रेड हटा दीजिए, ब्रेड कम कर लीजिए, उसमें यू नो प्रोटीन एलिमेंट अपना जो आपका टिक्की होती है, आपका वेजिटेबल्स होते हैं वो ज्यादा खाएं. यू नो देयर आर वेज टू मेक मील्स हेल्थियर एंड रिड्यूस द शुगर कंटेंट. हर चीज में हम आप टमेटो, आई मीन लेट्स टॉक अबाउट टमेटो केचप. सबसे ज्यादा शुगर कंटेंट टमेटो केचप में, बट हम कोई भी सैंडविच पकौड़ा और उसके बिना नहीं खा सकते बिना विदाउट दैट टमेटो केचप. So just you know my child in class 4 or 5 had a chapter on reading the consumer labels. तो जो भी आप खरीद रहे हैं मार्केट में उसके पीछे का लेबल जरूर पढ़ लें कि उसमें कितना कंटेंट ऑफ शुगर है, उसमें कितना कंटेंट ऑफ प्रिजर्वेटिव्स है, स्टार्च है, एंड देन ट्राई एंड बाय. यू नो वी गो एंड बाय मेयोनीज और उस मेयोनीज में अंडा भी नहीं होता है. इट्स नॉट इवन मेड ऑफ एग्स एंड मेयोनीज कांट बी मेड विदाउट एग्स. So we are buying a lot of things in the market nowadays which are not technically what they are supposed to be. So be very wise users of things, of consuming things. कोक में, कोल्ड ड्रिंक्स में कितनी चीनी होती है हम उसमें लिखा भी नहीं है, बट इट्स एक्सेसिव अमाउंट ऑफ शुगर फॉर आवर टी. तो आप जब भी ऐसी चीजें चूज करें, इफ इट्स अनअवॉइडेबल वी आर डूइंग इट, देन उसके बाद पानी से अच्छे से रिंस करें, so that आवर टीथ रिमेन हेल्दी.
One of my colleague is asking that her daughter is 10 to 11 years, someone, and her milk teeth has not fallen.
हम 10 to 11 में 1-2 मिल्क टीथ रह गए होंगे, मे बी अगेन दैट केनाइन और प्रीमोलर्स, तो दैट इज नॉर्मल. बट अगर कोई भी मिल्क टीथ नहीं गिरा है तो दैट इज ऑब्वियसली अ कॉज ऑफ कंसर्न. अभी तक तो मोस्टली सारे मिल्क टीथ गिर जाने चाहिए, 3-4 ही रह जाते हैं, व्हिच इज फाइन.
Okay, ma'am.
Deepshika ma'am had some questions.
Yeah, I have one. Actually, sir, you can. मुझे अपने बचपन के दिन याद आ रहे हैं. I just wanted to share that.
Yes,
when
ma'am.
when my father used to give a sugar cane, गन्ना हाथ में दिया, and and said this will help you long way. And I remember, I mean, till date. So you can also suggest, tell the children, how can these things help. So
मैम, यू आर एब्सोल्युटली राइट. जो पुराने चीजें थी, पुराने रिवाज थे, गोइंग टू द ग्रास रूट्स, कि हम आई डोंट नो, आधे बच्चों को पता भी नहीं होगा कि चीनी गन्ने से बनती है. सो गन्ना आजकल तो दिखता भी नहीं है, बट आई डू टेल माय पेशेंट्स हु हैव बैड टीथ कि गन्ना मत चबा लेना जाके, बिकॉज नाउ द टीथ आर नॉट केपेबल ऑफ डूइंग दैट. So गन्ना is something very hard, and definitely when you're going to, that's what I was saying कि बच्चों के दांत इतने इजीली आजकल टूट नहीं रहे हैं, because we are not chewing things like that. हम गन्ना नहीं खा रहे हैं, या हम गुड़ भी नहीं तोड़ रहे हैं, हम तो चीनी बस घोल के खा रहे हैं. अगर आप हार्ड गुड़ भी अपने दांतों से तोड़े हैं तो वो मिल्क का दांत हिल जाएगा ना अपने आप, डेंटिस्ट के पास आने की जरूरत नहीं है. और इफ यू आर बाइटिंग इनटू एन एप्पल, वो दांत उसी में आ जाएगा. So we are maybe trying to cut them too small or give kids something which is very cooked. Raw चीजों का भी अपना एक बेनिफिट होता है. So raw गुड़, raw गन्ना, raw fruits are very good.
actually well said, ma'am. Muscles अच्छे strengthen up होंगे तो
Yes,
आधी
ma'am.
प्रॉब्लम वैसी सॉल्व हो जाएगी.
Absolutely, ma'am. आप बिल्कुल सही कह रहे हैं, बिल्कुल.
A whole apple, a whole fruit, it's very important.
Yes, yes, ma'am.
Yeah. And I
So-
should say it was such an informational session. Even I learned a lot. So it
Thank
was
you, ma'am.
amazing.
That's
Thank
So, Dr. Anika, we have another question from Acharya. It's saying, how does not cleaning the tongue affect our teeth?
like I just said, not cleaning the tongue means you're not removing all the coating that happens on the tongue. Mouth के अंदर ही तो सारे बैक्टीरिया है. So it is coating your teeth, it is coating your cheeks, sulcus यहाँ अंदर जाके भी खाना फंस जाता है. Tongue के ऊपर तो, tongue is not a smooth surface. Tongue is a rough surface. Tongue के ऊपर तो tongue helps you to taste things, right? So tongue के ऊपर पैपिले होते हैं, मतलब एक grooves होते हैं जिनमें फूड लैंड करता है और हमें उस फूड का टेस्ट आता है. बचपन में अगर साइंस में हमने देखा होगा टंग का डायग्राम, टिप से आपको स्वीट टेस्ट मिलता है, बैक से आपको बिटर टेस्ट मिलता है, साइड से सॉल्टी टेस्ट मिलता है. सो द टंग हेल्प्स यू टू टेस्ट. दैट्स व्हाई इट्स नॉट अ फ्लैट स्ट्रक्चर, इट इज ग्रूवी स्ट्रक्चर. तो उस ग्रूवी स्ट्रक्चर पे अगर हम नहीं क्लीन कर रहे हैं उसको, तो डिपॉजिट्स तो और ज्यादा होंगे. मोर डिपॉजिट मीन मोर बैक्टीरिया. डिपॉजिट के ऊपर डिपॉजिट होना सबसे इजी काम है. तो इफ यू हैव अ थिन, घर पे अगर कोई टेबल साफ है तो वो स्मूथ है, उसमें मिट्टी जम गई तो 2 दिन बाद और मिट्टी जम जाएगी अगर हमने उस मिट्टी को नहीं हटाया. तो रफ चीजों पे और रफ चीजें डिपॉजिट हो जाती हैं. द स्मूदर वी कीप आवर टीथ एंड टंग बाय क्लीनिंग देम, द लेस बैक्टीरिया विल कीप, लेस डिपॉजिट्स विल हैपन ऑन देम. So we will taste better, we will keep our mouth healthier. Tongue cleaning is very, very important. I can't emphasize more.
Okay, great. So I think that answers that question pretty well. So there are still people who are asking that their children, like their brothers or younger brothers, they're
6
like,
months,
and their milk teeth or their teeth haven't come.
That's
Is it-
that. 6 months
Yes.
is teeth. 6 months पे teeth नहीं आते हैं. They will start at 6 months in reading some book, but 9 months, 10 months तक शुरू होंगे, which is fine. There are people who come कि 1 साल का हो गया अभी तक एक दांत नहीं आया, which is also fine. So it's a timeline. जरूरी नहीं है 6 महीने पे आ जाए. 6 महीने
How
पे
long the parent must wait for the coming of the permanent in once the milk teeth have fallen, and how long it can be?
मैम that's a good question.
How
So
long?
milk teeth के falling पे और permanent के आने में एक gap time होता है. Sometimes you will see कि वो permanent थोड़ा थोड़ा दिखने लग गया है, sometimes नहीं दिखता है. तो अगर परमानेंट मिल्क टीथ के गिरने के बाद 3-4 महीने तक भी परमानेंट आपको नहीं दिख रहा है तो आपको डेफिनेटली डेंटिस्ट के पास जाना चाहिए। 1 टू इवैल्यूएट कि परमानेंट नीचे है भी कि नहीं है, दूसरा कि वो कहीं फंस तो नहीं गया है नीचे में भी, द डेंटिस्ट जस्ट नीड्स टू क्लीन आउट द टिश्यू अ लिटिल और वो फिर इरप्ट हो जाएगा।
Because they're writing the 10 months, it's over now, the new teeth has not come.
हाँ,
So
so
that
अगर
is something
मिल्क टीथ निकले हुए 10 महीने हो गए और परमानेंट अभी भी नहीं आ रहा है तो हो सकता है कि कहीं वो टेढ़ा मेढ़ा होके फंसा हुआ हो। And also depends on what is the age of the child, I would like to know.
Someone is writing 8 years old and something like that. One child.
8 years old means they mean the side tooth here, laterals होंगे उनके।
Okay.
और अगर वो टूट चुके हैं और अभी तक 8 महीने तक नहीं आ रहा है तो कई बार होता है कि जगह ही नहीं है। They should show to a dentist once.
And one of them writing 13.
13 again is an
That's
age.
That's
Yeah,
a different question. I think that some places teeth haven't come.
Yeah, so 13 also most of the teeth have already erupted. कुछ canine के area में रह जाते हैं corner teeth and यहाँ पे एक premolar. So again dental visits at 12, 13, 10 are very important to see कि आपके सारे दांत आ गए। आजकल के most बच्चों में at 12, 13 के एज में दांत बिल्कुल alignment में 100% नहीं होते हैं। So it's you're a teenager. It's good for you to know now that आपके पास एक option है अपने दांत को सीधा करने के लिए. If you're coming at 25 to me, at 30 to me to align your teeth, that is also possible. Alignment is possible for a 50-year-old also. दांत सीधे करना is not a thing that will happen only at 11 or 12. It's easier at 11, 12, 13 because आपकी bone softer है. It happens quicker. But अगर आप you will come to me at 20 also that I need alignment of my teeth, that is also possible. But the parent and the child should know that 13 पे acceptability of braces. भाई अब जब आप ऑफिस में जा रहे हो और आपके वो तारे लगी हैं, would you accept it then when you are in college or while you are in school? It's easier for you to accept these things. Everyone has braces at that time. So braces का timeline generally is during that teenage phase of 13, 14, 15. आपका वो टाइम पीरियड मिस भी हो गया है। लेट्स से देयर आर पेरेंट्स हियर हु किड्स आर बिगर एंड स्टिल हैव malaligned teeth, दांत टेढ़े मेढ़े हैं या और कोई इश्यूज है, this teeth can still be aligned at 30, 35, 40 also teeth can be aligned.
Great. So I think that was a brilliant session, Dr. Hanika. I think everyone learned a lot, and I think we also went back to our childhood when we were like having all the sweets and we were told not to have them. So now I think I know you have another meeting after this. So I just like to invite Dr. Ms. Somalidas to just give a vote of thanks and then we can end the session.
Thank you, Dr. Hanika Agarwal, for the wonderful session. You've explained so beautifully how to take care of the dental and the oral hygiene. I hope all of our children, even the parents, have understood the importance of dental care and when to see the dentist and what precautions or what steps they must take if they are finding any problem in that. And I hope you have answered all questions excellently. All of our queries regarding the dental health, I suppose, have been taken care of, and you have satisfied all of our whatever things we wanted to know. And thank you once again on behalf of Heartcare Foundation of India, Ramjas Public School, Columbia School, and Universal Public School for this wonderful session. Thank you, ma'am.
Thank you so much, ma'am. I had a great session myself. It was a great learning experience and great to meet such great principals and teachers and Mr. Ankit here. And it was a great session, I think. I hope the kids learned a lot.
Thank you so much.